Hello everyone, my name is Michael Taylor and this is my presentation on the Affordable Care Act and the field of public health through the Division of Online and Professional Studies through the California Baptist University under the American Healthcare System course uh, through the teachings of Dr. Janet H. Bonham. Over the course of this presentation, I plan on covering the following subject material in regard to the Affordable Care Act, or also known as ACA or Obamacare. I plan on covering the significance of the Affordable Care Act, how the ACA plans to deliver health care. I'm also going to try and compare the healthcare system within Germany in comparison to the Affordable Care Act and our current healthcare system within the United States, as well as try to cover lessons that the United States can learn from Germany and its healthcare system, the strengths and challenges that the ACA faces, as well as the ACA's future directions, and finally a conclusion. There are many significance of the ACA. Those are instrumental formal legislation. It has set a standard minimum of mandated health care, public health benefits, as well as reduced public health burdens. It would mandate that all citizens would have a minimum requirement for health insurance and that no disqualifications for pre-existing conditions. As stated, the Affordable Care Act, which is also known as Obamacare, is an instrumental form of legislation that does aim to provide health care to all citizens and residents that reside within the United States of America. The ACA aims to provide a minimum standard of health care that every resident of the United States is required to maintain. Through the expansion of medical coverage to all citizens, the provisions provided by the ACA help the field of public health through many avenues. Many of the aspects of the ACA help by raising public awareness of preventative measures through clinical preventative programs, which provide access to health wellness programs that in turn help to reduce and mitigate further medical expenditures through unneeded medical practices. With the continued expansions of Medicare and Medicaid programs, individuals that previously were not covered under private insurance can now receive medical treatment for chronic conditions, as well as not be denied services due to pre-existing medical conditions. The field of public health also benefits from the reduced burdens on public health programs that would have previously provided medical care to those that were underinsured. Randall R. Boveberg states, as the burden for previous public health programs is reduced, the field of public health can further benefit through the added resources and financial backing that the ACA provides for preventative care. On top of that, with added financial backing as well as the reduced need to fund public health programs for uninsured individuals, the field of public health can also obtain funding and reimbursements through private and public insurance programs to further preventative measures and preventative care throughout all communities, as well as primarily concentrating on low-income communities and communities with vast demographic racial disparities. The healthcare delivery. Healthcare delivery has an impact in which healthcare is delivered, reduces burden relief through preventative measures, and creates a healthcare transparency. Many of these factors, when trying to address healthcare delivery, should be considered the way the ACA will impact how healthcare will be delivered. Much of the improvements that will be noted through the enactment of the ACA will be the requirement to have medical insurance. With the provision of an established minimum requirement of health care coverage, ACA helps to deliver a broader range of medical and preventative health care coverage for all citizens of the United States. With these measures, healthcare providers can provide for and plan the proper usage of limited and valuable healthcare services for patients with the reduction of the overusage of previously limited resources, such as the overusage of emergency room services in low-income communities. With the ability to provide preventative health care interventions, the ACA aims at helping to reduce the financial burden that comes with providing services for what is deemed preventative health care measures. Many other considerations on how health care will be delivered will be through the implementation of programs that aim to measure the quality of care that healthcare providers provide. The measures aim at providing transparency to the quality of care providers and their services throughout the United States and uses already current quality measures established through Medicare. Through the transparency of these measurements, the healthcare providers that reach a quote-unquote designated quality measure will be able to receive compensation and subsidies through the ACA. This would allow for the ease of selection in which a patient chooses their healthcare provider, giving the patient more autonomy as well as an ability to research and understand the care that she is being provided, as well as the benefits from that particular health care. One of the issues that we have in our healthcare is how it is compared throughout the world. There are many that feel the healthcare system in the United States is fine. Many feel that it is broken and want to adopt other programs throughout the world. Some of these that we hear quite often is about universal healthcare. So since universal healthcare is one of the ones that many individuals try to compare or want to strive toward within the United States, I decided to choose and compare the universal health care that Germany currently has, as well as to give a comparison of political compromise that they reached, as well as what sickness funds are, the availability of private insurance, and the impact of private care for physicians versus specialists. During the 19th century, the organization and enactment of the current healthcare system in Germany has been one that shows and demonstrates what can be achieved through political compromise. As the German government began to organize the healthcare structure, multiple compromises were made. Some of these compromises included the industrialization and urbanization of the healthcare system, allowing for sickness funds to be created, as well as creating national health insurance, which was established in 1883. And through this establishment, it removed that of an authoritarian state and allowed for the control of the healthcare system to later. It removed an authoritarian state and took control of the healthcare system later toward the end of the 19th century and the beginning of the 20th century, which also led to the sickness funds being managed by employers and their employees. So by allowing employers and employees to manage their own funds, the government no longer was in control of the funds, and this gave more autonomy towards the employer and employee in being able to pick their insurance plans. So how does this healthcare system compare to the current healthcare system within the United States and the coverage compared to the enactment of the ACA? Unlike the United States, Germany has adopted a national healthcare coverage or universal healthcare that has many different aspects to that of the ACA. Under German healthcare, no citizen is without insurance, with approximately 92% of German citizens having healthcare coverage. This is through mandates and requirements that the government instills upon the people and employers and employees. As the ACA mandates all citizens to maintain a specified level of healthcare coverage, all citizens, including non-citizens, are required to pay into a national health insurance program in Germany. This contribution is still required of all citizens and non-citizens regardless of whether they have private health insurance. Unlike the United States, the many different private insurance programs offered through businesses, in Germany, only approximately 50 businesses in Germany actually offer private health insurance coverage. This is due to the mandated national health insurance. Even those that have the opportunity to receive private health care coverage typically choose not to participate, in part due to the mandated contributions to the national health insurance program. Though Germany's healthcare system allows for citizens to choose their generalist physicians and specialists, dentists, hospitals, and long-term nursing care, the care is chosen through that of previously set programs, and they limit the citizens as to where they are allowed to go based upon their geographic location. With the limited resources and the limited amount of specialists and higher primary care physicians, Germany, much like that of Britain, have adopted a more structured approach to how an individual will receive healthcare coverage. For a covered individual to receive care from a specialist, a private care physician must first make the recommendation for cause, and then the services are then further reviewed by a panel. What this does create is, unlike in the United States where you have patient autonomy, it creates within Germany a professional autonomy within the German healthcare system, unlike that of the United States. This allows, within the United States, due to the individual autonomy approach, it allows those insured to go directly to the specialist of their choice as long as the specialist is covered within their healthcare coverage, and allows them to choose their specialist, or even if they have the financial means to pay for the specialist services, they can choose to do so. Whereas in Germany, once your PCP allows or makes a recommendation and then the health review board agrees with the recommendation, the individual still may not have the opportunity to choose a specific specialist based upon their geographic location. The German healthcare system is dependent upon payroll, taxes, or sickness funds to prosper, whereas in the United States it requires its citizens to purchase the insurance with their earned income post-taxation. Though taxes are taken for healthcare coverage from the American taxpayer, the amount is far less than that of the contributions made by a German citizen. A further problem with the German healthcare system is the reduced co-payments made by citizens. Many within the democratic parties of Germany's political system have debated recently on raising contributions made by citizens, and those within the Christian Democratic Party have argued as to how much a citizen should pay in concerns to co-payments, opting more for citizens to still not have to pay co-payments. With this said, there are lessons that the United States can learn from Germany. One of those is universal health care is expensive. Employee and employer-made contributions provide more medical services than that of general taxation. Long-term care for elderly, mentally and physically disabled citizens is viable. As a comparison of the German healthcare system and that of the United States healthcare system and the enactment of the ACA, there are still many lessons that the United States can learn from. Some of these lessons can be that of more employer and employee-based contributions versus that of general taxation to help sustain the healthcare industry. One of the biggest lessons that can be retrieved is that of the understanding of the overall cost in which universal healthcare would cost the American people. With employee and employer contributions, Germany has been able to show that they can purchase more comprehensive medical services than any program within the United States can. One further aspect of the German healthcare system that can be learned is the ability to provide long-term care in a variety of situations. Germany has been able to provide long-term care for elderly, mentally disabled, and physically disabled citizens for over 120 years. Germany has also demonstrated an ability through the higher usage of PCPs to provide more preventative care options within the United States, which currently trails behind in the amount of PCPs. Though vastly different approaches to healthcare, the United States healthcare system and the enactment of the ACA demonstrate many strengths and challenges as well. Many of the strengths and challenges that the ACA has had since the enactment of the law have been that more than 20 million previously uninsured citizens now do have healthcare coverage. The ACA has also been able to provide coverage for those with pre-existing conditions and create funds such as the Preventative and Public Health Fund that help states and their public health departments respond to and help prevent the spread of disease throughout their communities. Other strengths have been the ability to give tax cuts to businesses and millionaires that assist with the expanded healthcare coverage. One of the most notable strengths of the ACA is the legislation that helped to eliminate previous gaps in coverage that many elderly citizens were experiencing concerning preventative drug costs. Further, the strengths of the ACA have been the purpose of trying to create a transparent healthcare system in which the residents of the United States can seek and understand the overall care in which they are receiving. There have been many challenges that have been presented through the ACA and which it has faced over the past decade. Some of these issues have ranged from the forcing of mandated requirement of healthcare coverage upon the citizens of the United States while ignoring the approximately 28 million undocumented and illegal residents residing within the United States. Many families and individuals found that it was cheaper to pay the fine than it was to pay for the required minimum standard of health care. The overall rate of which uninsured citizens was perceived to decline through the enactment of the ACA, the United States as a whole still has approximately 45 million residents who are still uninsured, which is approximately 15% of the United States. Further issues with the ACA were the many citizens who lost previously business-sponsored and provided health care coverage. There were approximately 6 to 8 million employed citizens that lost these previously sponsored benefits. These are but a few of the challenges that the enactment of the ACA face, and still face currently. So what is the future direction of the ACA? The future direction of the ACA will aim at providing a means in which all residents, and not only citizens of the United States, will be able to apply for and receive a prescribed standard of health care coverage. As the ACA continues to provide preventative measures for health care and incentives and subsidies to hospitals and health care providers, more residents and citizens in low-income communities will be able to receive quality services within their communities that were previously inconceivable. With the measurements put in place that will measure the quality of care, the future of the ACA will allow for qualified medical specialists to create and establish practices within the low-income communities that will allow for a higher quality of care. With the further expansion, the future will also allow for the monitoring of healthcare providers and ensure that needed medical care will be provided and an overall reduction of unnecessary services will be obtained. Though the ACA has increased the availability of healthcare throughout the United States, it is still uncertain as to the future implications that the enactment of the ACA will have on the economy as well as the healthcare industry. With mandated requirements that have the potential to violate the rights of the United States residents, many challenges remain and continue to present themselves. The ACA will continue to need further amendments and exemptions to fully satisfy the needs of the healthcare industry's economic impact. Further implications of the ACA and challenges that it will continue to face is to reduce the overall expenditures that those in low-income communities currently face, as the out-of-pocket payments and the prescribed forced mandate services still take a higher percentage and chunk of citizens in lower income communities and throughout racial disparities in their communities, these individuals still pay more of their income towards healthcare than that of middle income and higher income brackets. The ACA has allowed for great deliberation in concerns to the healthcare system and how the healthcare system can not only affect both the citizens, non-citizens, but integrate principles and beliefs of many different cultures and religions. Uh, uh, this is the concluding statements of my presentation. Uh, I hope everyone enjoys my presentation, and thank you for your time and effort in watching my presentation.